started with PracticeOne in 2004. We decided to implement the program in stages. So in January of 2004, we started with the practice management side, and by August of 2004, we were up and running on the electronic health records. One thing that I found with PracticeOne is that how user-friendly it is. I mean, to the point of when we went live on the practice management side, we had a week's worth of training in that function, and Jenny was only there for 4 days because we didn't need to have all the extra training. It was so user-friendly, we didn't need to have the extra hand-holding that we thought that we would need to have. The same with the EHR side of it. We went live and it was completely seamless. We didn't have this major influx, we didn't have frustration because it was so easy to understand and implement that it was just incredibly smooth. We designed 86 different templates so our physicians could easily right-click and drop in a template or a subnote, create any kind of situation that might come into our office. The flow has gone just very smoothly on that. But how we implemented from paper to paperless is very seamless, and I think the physicians have to buy in to understand and acknowledge what the cost is and the time frame is. We did a lot of setup on the back end to make that first day go really, really smooth for our doctors, because that's who we created this system for, was for them. They have to be able to own it, love it, work it, understand it to make their day go better. We had the one physician who wanted to get going on everything be paperless day one, and then we had another physician who would rather handwrite everything because it was more efficient to her than even dictation. So we had major extremes. And the success of it is the physician actually recognized the fact that this was a success, that it was something that actually improved her workflow. The follow-up for things made it easier. The visual I have is the stacks of charts. You had an inbox, you had an outbox, and then you also had these have to be taken care of right away box, and then you had these can wait a little bit box. I mean, the amount of stacks of charts, that's gone. And to me, that's a success. And we're not searching for charts. I mean, that's huge. Our patients, I think, have really liked it. We can send their prescription right away to the pharmacy. We can correspond with their primary care physicians immediately. We can send them with their records if they are moving to a different state the last day of their appointment. They don't have to wait for 30 days to get the paper in the mail and then take it with them. The best feedback I've had from our patients is simply the e-prescribing. They leave the office knowing that their prescription's on the way, and they get there and it's either there or it's being processed. They don't have to lose the piece of paper. We don't have to call it in, and it's just there. The best thing that I can say about PracticeOne is it fits the needs of every individual physician, so they can still practice their way. They don't have to conform to a specific type of template, or they don't have to conform to a certain way to do certain things, because they can still be individual physicians practicing their individual way for their individual patients. That's huge for a physician, because I can tell you that that's what the one thing each doctor wants to do. That's why they go to medical school, so they can practice medicine the way they want to practice medicine. So I think it's wonderful.